So this abstract that's being presented at the EHA meeting this year is a single center investigator-initiated clinical trial enrolling patients who have not received prior treatment for follicular and marginal zone lymphoma and have an indication for treatment. All patients will receive 8 cycles of Mosunetuzumab with step-up dosing with subcutaneous administration. And after those 8 cycles or 24 weeks, patients will have a PET CT. Those who have a complete metabolic response on that PET CT will then be observed. And those who only have a partial remission or stable disease with benefit from the initial treatment can then receive Obinutuzumab and Polatuzumab vedotin for up to 6 cycles. So far, we have enrolled 38 patients on the study, almost all of whom are follicular lymphoma, either grade 1 to 2 or grade 3A. All of them, as I noted, have an indication for treatment, most commonly symptomatic disease, which was in 79% of patients. And so far, in terms of the safety profile, appears consistent with what we've seen in the relapse data that's been presented so far. Cytokine release syndrome was common in about 2/3 of patients. However, no grade 2 or higher cytokine release syndrome was observed. Approximately 53% of patients had a headache of some grade, 5% of which were grade 2. Injection site reactions were almost universal, seen in 87% of patients. About a quarter of patients did have some dose delay due to toxicity, which included infection or neutropenia most commonly. In terms of grade 3 or 4 AEs, the most common grade 3 or 4 AE was neutropenia, observed in 11% of patients. And so far, as I noted, we've treated 38 patients, and 31 of whom have had a post-treatment PET CT after at least 8 cycles of Mosunetuzumab, and the complete response rate at that time point was 81%. We also did measurable residual disease testing utilizing phase-seq through Foresight Diagnostics. And so we had 22 patient samples available for analysis at the time of abstract submission. Almost all the patients had detectable baseline ctDNA, so 21 of 22 patients. And at the end of treatment, the undetectable measurable residual disease rate was 71%. So far on the study, we've only observed 2 progression events to date. All of them were biopsy-proven transformations to large cell lymphoma. So we concluded that fixed-duration Mosunetuzumab monotherapy had a high complete response rate, including most patients clearing their ctDNA at the end of treatment. And we found that this could be safely administered as an outpatient with no grade 2 or higher cytokine release syndrome observed.